Well, when your forever friend isn't acting like themselves and you know something isn't quite right, how do you know when it's time to visit urgent care versus emergency care? Here to help us determine which is the right choice, Dr. Kanan Shores, who leads the urgent care services for dogs and cats at the University of Illinois Veterinary Teaching Hospital, is here, as well as his forever friend, Gabby. Thank you for being with us.
Yeah, thanks for having us.
Okay, so I think a lot of times this is the same as with adults. You're not sure, is this a serious enough ailment that I need to visit emergency room for, or just a convenient care? Is the same for pets?
Right, right. Yeah, that's a pretty good guideline for how we encourage folks to think through the process, to reflect back for themselves, you know, how sick am I and how much pain am I in? Does this seem to be an emergency room type visit or not? So for us, another kind of rule of thumb is the urgent care department is there for the types of cases that you would normally go to your primary care veterinarian for. So these are general practitioners that are going to see you for, or the pet, for cases that are urgent. They do need to be seen and addressed, but they're not life-threatening. So, but a lot
How would we know, though, if it's not or if it is life-threatening? Because I would think it's my dog. Of course, everything's life-threatening.
It's a great question. It's a great question. There are guidelines, and there are guidelines that are out there. In general, breathing problems, difficulty breathing is up high on the list. If the gums are an abnormal color, so purple or blue or pale, so very light in color, they should be pink like your shirt. Very distended abdomen, if the pet is very, very lethargic, so very low energy level, those might all be indications that this is a more serious problem.
Okay, so head to emergency services for that.
Correct, correct.
Let's talk a little bit about maybe if Gabby's experiencing some other symptoms that would constitute going to urgent care.
Yeah.
What kind of symptoms would that be?
Yeah, so we cover everything from nose all the way back. So whether that's sneezing or a nasal discharge, back to, we do see dogs for tail problems, eye discharge or squinting, you know, minor bleeding from the mouth, ear problems, GI troubles, urinary problems, limping, lameness, cuts, abrasions. So we see a whole slew of different types of things, but these are generally, the pets are up, they're active, they're maybe just feeling a little bit off. Another great guideline is just call us if you have a question. If your primary care vet is not available, call us at the urgent care service, 217-244-2555, which is there on the website, as well as our emergency department. They're open 24 hours a day. You can always call them as well. One of us will be able to help push you in the right direction if you have specific questions.
So this would also be a great example of when you can't get into your regular veterinarian. But then if you go to, like, urgent care, then how is your vet back home going to know, oh, well, Gabby here was seen for some bleeding gums or something like that?
Yeah, great question. So, yeah, so we definitely encourage people to go to their primary care vet. We're there as an extension of their vet if they don't have an appointment time available that fits with what the client needs. We take a lot of pride in trying to keep the primary care vet in the loop, so we send them full reports, everything that we did and found. And so it's really important for us to have people follow up with their primary care veterinarian as well.
Okay, now I know if nowadays, used to, you would just have to like walk in and get your appointment for human to like convenient care, or you could sign up online and kind of like notify them, hey, I'm coming.
Right.
What's kind of the rules here with animals?
Yeah, great question. So we're a walk-in only clinic, so we don't take appointments. We do appreciate a heads up phone call, so that gives us a little bit of a chance to be as ready as we can be for your pet whenever your pet comes in. So walk-in only appointment, and we do work on a triage basis. So the sickest pets are going to be seen first. Yeah. And sometimes those are things we can address in our office. Sometimes we will end up referring them to the emergency department if we detect it's a more serious problem than we originally thought.
Okay, tell me about Gabby.
So Gabby, she is a about 13 and a half year old girl. We've had her since she was just a little thing, 8 weeks. She's a Shih Tzu Yorkie mix, and she's got a big brother who's her size, but she looks up to him a lot at home. So she's kind of lost without him, but she enjoys, her favorite 30 seconds of the day are eating. So it takes her 15 seconds in the morning, 15 seconds at night, sucks it down, and she really enjoys her food. So we try to keep the pounds off.
Gabby, as do we all. So thank you for coming and sharing her with us. Lots of great tips there. If ever you are in the need of making that decision, do we go to the emergency room? Do we go to urgent care? If you want to see all of those tips again and connect with our friends there at the Veterinary Medicine South Clinic where they handle all of those cases, we'll have that linked up at CILiving.tv.